Hello and welcome. You're watching Market IQ and I'm your host Pallavi Nahata. Now, the government has confirmed its first case of travel-related monkeypox in a young male who tested positive for a strain from Western Africa. The Health Ministry has said that the patient is in stable condition and is without systemic illness or comorbidities, having already been isolated over the weekend on suspicion of carrying the virus. Now, I'm in conversation with Metropolis for more details on how this is going to be for India going ahead. I'm in conversation with Dr. Nilesh Shah. Sir, thank you so much for taking time out for us today.
My pleasure. Thank you so much.
So, with Mpox becoming a rising concern, could you help us understand what is the testing infrastructure in the country currently like for monkeypox? What are the kinds of tests that are available?
So there are two kinds of tests. One is a molecular test where you detect directly genome of the virus, much more reliable than anything else. And there is a serological test which reliability is yet not proved. So it is a molecular test, which is PCR test, what we used to call during COVID. PCR is a technology, and same technology will get applied here to detect viral genome. And there are, as you know, in the country, there are almost 2 lakh labs. And during COVID time, almost 3,000 to 4,000 labs geared up to run this test, and maybe a little more on a small scale. But eventually, these labs had to shut down. Many of them had to shut down their PCR technique because the volumes were not there. But still, I would assume 400-500 labs would be ready for doing PCR. This is going to be conventional PCR. They would be ready to do the test. And that will be the process ahead or plan ahead to support any screening test required for this.
Okay, all right. So as a nation, we seem to be decently prepared to scale up testing as and when needed, depending on the trajectory going forward. But tell us, how contagious is Mpox? So far, we know it's down to just one case. But what is the baseline assumption that the medical industry is currently working with?
So it is contagious, and there are three methods by which contamination can occur. One is direct contact with the patient. Second is contact with any of the belongings of the patient which is infected. And third is, suppose you go very close to the patient, there can be respiratory droplets which can impact and can have an infection. And that is why during the collection, you have to wear PPE and take care that none of these things you acquire with. And these patients are also fully isolated. Isolation is first primary important part which you need to take care of it. So one has to be cautious, not get paranoid, stay cautious, but not get paranoid about it. That is very important message I would like to convey. And there would be probably testing required under doctor's guidance. On your own, one should not attempt to do it, but under doctor's guidance, it is required. And whenever government feels appropriate to permit private labs to run the test, I think testing platform at least Metropolis, we are quite ready. We have finished our validation. We have the kit. We have not tested on live samples yet, but prototype samples we have tested, and the validations have passed.
All right. So in that case, what are the precautions that you would suggest our viewers could take given the current scenario?
So hand hygiene and self-hygiene is most important. Avoiding contact with such patients in case you have somebody in future, suppose somebody comes in your family or friends or nearby people, avoiding contacts and 3 things as I told you, that one should take care of it. Beyond that, right now, there is nothing more to do. One should continue with the hygiene part. Nothing more one can do at this stage.
All right. And you know what is the treatment currently that is available in the industry in case somebody has contacted Mpox?
So the treatment is a self-limiting disease. So the disease gets cured on its own. The doctors would only do 2-3 things. They would isolate the patient and ensure that there is no cross-infection. And second, they would ensure that all supporting treatment to give a relief on a side effect. The support treatments are given to the patient so patient can feel a bit better. But otherwise, to cure the disease, it's a self-limiting disease, so there is no treatment. And honestly, I think this is a more of a clinician subject than a laboratorian like me to comment more on it. But it's not something to so fatal or anything, and the complications are also very very rare. One can have some complication like you can have pneumonia and you can have infection on the eye. One can lose eye at times, but these are very very rare and less condition to be worried about.
All right, and would you be able to provide us any updates on the latest status in terms of the vaccines? And while we do know that those are under development and it might be some time away before we can have access to that, what is that picture looking like broadly?
As of now, there is no news about vaccine, that there is a dedicated vaccine which has been given, but the regular vaccine which you have been taking for smallpox and all, or pox vaccines, they have been proven to give little bit support for avoiding Mpox. And now it is no more monkeypox, it is Mpox, by the way. And so that gives support, but there are no vaccines otherwise which have been made specifically for this.
Mr. Shah, thank you so much for taking time out for us. This was most informative for our viewers as well.